As COVID-19 death rates increase in provinces such as Gauteng and KwaZulu-Natal, it draws into sharp focus their state of readiness to respond to the pandemic. To that end, we are going to be looking at provinces in depth. We just looked at Gauteng. Now we are looking at KwaZulu-Natal, and to take me through what exactly is happening in his province is the Premier, Sihle Zikalala. Premier, thank you so much for joining me here on The Fix. Let me start by expressing my condolences for the loss of one of your MECs, Mr. Bheki Ntuli. My sympathies to his family, and of course also the government of KwaZulu-Natal. The situation in KwaZulu-Natal has bedeviled some. You've reported a drop in your infection rates, but some are saying that this 27,000 drop, raises more questions than answers. Are you satisfied, Premier, that the explanation that the MEC gave for the drop in infection rates is an accurate reflection of what we're facing in KwaZulu-Natal?
Now, thanks, Karima, for having us in your programs. Of course, thanks for condolences, and once again, we send our deepest condolences to the family of Comrade Mpemba, Bheki Ntuli, MEC for Transport, Community Safety and Life. Yes, we are. We're confident of the statistics because this comes from the National Coronavirus Command Council. The tests are done. Once they are done, when people are tested, numbers are coordinated nationally as the minister will release the stats. And once the stats is released, it also then gets separated into provinces, into districts. So yes, the numbers are dropping, but it has not been a trend. Let us not take a drop as a trend. For instance, I think this week we dropped, which was very positive, to 3,000. But you find that when we go to 3,000, the following day you likely go up. So we have not reached a trend which goes downward. And that's why we are saying, let us all try and adhere to non-pharmaceutical measures that have been put in place and all protocols.
Now, when we look at the question of the numbers, one of the criticism from the unions have been your ability to admit patients. Are you satisfied, Premier, that people have access to your hospitals? We see here in Gauteng there seems to be a problem, at places such as Steve Biko. Are you confident that you've got your situation under control? Have you had to put up extra field hospitals, for example?
During the first wave, we established a number of field hospitals, but when there was a decline, we were compelled to take them down, and we were criticized for establishing field hospitals. You will go, even if you go to the AG's report, you will find that criticism. But with this peak, we have been compelled to reactivate some of them. We have reactivated the field hospital in Pietermaritzburg, and it is now active and working. We are working in re-establishing ourselves in eThekwini, but I must say we have not reached a point where we go out of, we run out of capacity. What has been happening is that patients will go to the private hospital, and they will not get beds, and then it will be reported as if all hospitals don't have beds. And that's why we've intervened and established a coordination now between the private hospitals and the public so that the management will be done easy. If someone does not get a bed in a hospital in the Durban CBD, it should be easy to take that person to a public hospital that is nearby.
Okay. Now, Premier, I just want to go back to the fact that you said you were happy with the stats because they are nationally collated. 9 days ago, everyone was focusing on KwaZulu-Natal because your numbers and your active cases were, increasing. The province then had over 67,000 active cases, which was more than any province had at once. It was also significantly more than the Eastern Cape, which was leading the province in the case of death. So how did you go from that stat to where you are 27,000 down, and how do you explain that anomaly given the fact that your active cases were in fact climbing?
Well, once active cases are reported, active cases are going with your infection. And once the infections goes high, active cases remain high for that particular period. It can be 2 weeks or so. And once you begin to have a slight decline in the infections, it also talks to the fact that even your active cases will be declining. And that has been the way. But we must say that we are not saying we are out of the wound or out of the woods or out of the challenge. The challenge is serious. It is major. All of us, individually and collectively, have to act responsibly.
Now, the South African Medical Association, SAMA, accused your government of lying about the severity of the situation in the province. They say that the health MEC, her claim that there were enough beds, and you again said that there were enough beds, is simply misleading and counterproductive. Now, the National Institute of Communicable Diseases also said it was concerned about the province. The Acting Executive Director Adrian Puren said, when you look at the data of eThekwini, it is very distinct in terms of the number of cases that are being identified, as well as the deaths and hospitalization. It is of great concern. He said it was unclear when the second wave would peak and hit the province. Now, you've repeatedly said we're not out of the woods. Your MEC for Health have said the same, but you claim that your numbers have gone down. Surely there's a contradiction there.
No. The numbers are going down from the severe situation was faced 2 and 3 weeks ago, where we were reporting new infections on daily basis, which are above or close to 6,000. And that will tell you that when the new infections are high, and then you will get a challenge in terms of management of your beds and everything. That's why we are saying our capacity has not been exhausted, but on top of that, we are able to say this is the area that is mostly affected, and we intervene in that area. For instance, we have realized that there is a problem between your Ugu areas where the numbers are going high, and our capacity in terms of bed availability is getting challenged. And we started making a plan that in such a situation, should we run out of a bed, we will be able to complement Ugu with the nearest hospitals that are.
All right, Premier, we've had a technical glitch. We have to redial you. This is the age of, a big challenge. A lot of our interviews cannot obviously happen in studio. So let's take a short break and we hopefully get that communication up, and we will be back with the Premier of KwaZulu-Natal. Don't go anywhere.